Cosmetic surgery has become very popular. One of the most common procedures that we do here is what is referred to as a tummy tuck. We call it an abdominoplasty or a torsoplasty, addressing everything around the torso, whether that involves a combination of liposuction in the love handles and removing a little extra tummy skin and a little extra tummy fat. It is a full operation that carries risks associated with any other surgical procedure and anesthetic. When the patient comes in for an abdominoplasty consultation, we'll have a good assessment of the laxity of the tissue, the amount of adipose, the amount of fat that needs to be addressed, the stretch marks that need to be addressed, any separation of the muscles from pregnancy that need to be addressed. So who is a good candidate for a tummy tuck? I think that begins with who are the best candidates for anesthesia. And the way to answer that question is, how do we take the anesthesia risks and surgery risks and minimize those? The biggest risk I think that we have in our abdominoplasty population is a high BMI. So if patients can have their body mass index or their weight to height ratio in check before they come in for a consultation, then or certainly before surgery time, then that's going to help set up for a really good result thereafter. We always recommend that the patients get fully educated on the process, fully educated on the risks involved with the operation. And part of that should include a consultation with another plastic surgeon. The more educated a patient can be about their operation and the potential outcomes, the better. We have a website that has results that have been created here. They're not borrowed results, they're not made up results, they're actual patient results. I think that's a good place to start. Patients can often find someone that has a similar physique or body type and can see what the result looks like. It's very difficult to simulate procedures, simulate outcomes. And one good way that we have is to stand in front of a mirror with the patient and pinch here and pinch there and be sure that we get on the same page as to what the result might look like. Tummy tuck operations are one of the biggest recovery operations that we have. And that recovery really comes from putting the muscles back together that were separated from, say, pregnancy, or in patients that have had massive weight loss that may have been separated from when they were bigger. So that is really the number one cause of the lengthy recovery, which is about 2 weeks. We do everything that we can to enhance the recovery, whether it be from manipulation of the postoperative pain medications. We do have an enhanced recovery protocol in which we try to minimize narcotics and thus minimize the side effects of the narcotics as well. All of that helps with the recovery process.